Okay, as we start into clinical practice, the number one thing that's going to dictate what you can and can't do is going to be your state practice act. So, whatever state you're in, you have to know your state practice act. What are your direct access laws? What's your policy, or not your policy? What's your state say about dry needling? What about telehealth? Are you a part of the compact? What's your direct access limitations? Are you allowed to do spinal manipulation, HVLAT? So you have to understand your state practice act. That will guide you on what you can and can't do regarding your clinical practice of practicing physical therapy within that state. So, every state is going to have some sort of direct access laws. We have, but you have to really understand that because I ask PTs all the time in Florida. My practice is in Orlando, Florida. I ask them, do you know our direct access laws? And they just say, oh, we have 30 days direct access. I'm like, that's not right, actually. Did you read the next two sentences? So if you read our practice act, we have 30 days direct access if they've never been seen by a practitioner of record. And our practitioner of records are listed there saying it's a MDDO, a nurse practitioner, a PA, a dentist, a chiropractor, and a podiatrist. Sorry, I almost forgot the last one. So it's written by lawyers in a way that if they have been seen by a practitioner of record, we have unlimited direct access. Okay, and you can consult with a lawyer regarding your state practice act to get some clarity. You can even ask the board or ask your professional organization if you're a APTA member and ask them what their statement is on this and what their direct access laws. So you're not just interpreting it yourself and you interpret it wrong. Try to counsel with someone or consult with someone about this. You probably don't have to pay a lawyer. Your state organization, for us, the Florida Physical Therapy Association should be able to tell you exactly what is your direct access law. So it's not up to interpretation, but you need to understand what is your state direct access law. Are you allowed to do needling? What is the legal standards in your state to be able to practice needling? In Florida, you have to have over 50 hours of training. You have to be 2 years out of school. I know that sucks for new grads. And you have to have 25 practice sessions with someone observing you. So, every state's going to be different, but you have to know your practice act. Can you even do spinal manipulations? What's your telehealth stuff? Florida sucks with telehealth. We're not a part of the compact. So you have to see what are the telehealth standards within your state. Something else that you want to start thinking about is clearly defining what wellness services are and what skilled physical therapy services are, because there's a difference there, and it's going to allow you to do a little more freedom with some wellness stuff versus skilled physical therapy. So in our practice, we have a policy written up is what is wellness, what is medical fitness, and what is skilled physical therapy. So if someone ever came in and audited us, they clearly see what each program entails and how it's different. Skilled physical therapy service versus wellness and stuff like that. And then it's also going to kind of go over what is your minimum documentation standards. In the state of Florida, you have to do an eval to start a plan of care. And then you have to have 2 goals written to be able to do that. And then you have to have a discharge summary. So you're not required to do SOAP notes, but your state practice act is going to dictate what you can and can't do and what are those minimum documentation standards regarding that. So the point is, you have to know your state practice act in whatever state that you're practicing in, and this is going to tell you exactly what you can and can't do within your state, and then you got to strategize to overcome some of these limitations. Okay, so understand your state practice act.